Hello, my name is Dr. Nora Taha, and I'm one of the physicians at Spine Center and Orthopedic Rehabilitation of Englewood, also known as SCORE. Today, I'd like to talk about the healing powers of regenerative medicine and how we can use it to benefit our patients. My goal for today is to provide some information on insight and uses of regenerative medicine and why we've incorporated it into our practice. This talk is brought to you by the Spine Center and Orthopedic Rehabilitation of Englewood, located in Englewood, New Jersey. We focus on non-operative treatment of various musculoskeletal conditions, including osteoarthritis of the lower back, neck, shoulders, hips, knees, and small joints, herniated discs of the neck and back, tendon injuries, autoimmune disorders, muscle strains and fibromyalgia, peripheral neuropathy, and carpal tunnel syndrome. These are just a few of the conditions we commonly treat here at SCORE. We tailor a specific treatment plan to each patient and often incorporate regenerative medicine when indicated. So what is regenerative medicine? Regenerative medicine uses your own body and aims to stimulate healing of damaged tissue to aid in improvement and resolution of certain ailments. There's a lot of potential in this therapy, and it's often thought of as your body's secret weapon. Here at SCORE, we believe regenerative medicine is leading the way to better treat chronic conditions, and it's really the future and the direction that our field is heading in. Currently, we offer PRP, A2M, and stem cell therapy. Our intention is to provide our patients with proven, safe, and effective options as treatments develop. So just a disclaimer, most regenerative medicine treatments are not covered by traditional health insurance. And although these are considered to be more alternative treatments, there are multiple studies in the US that demonstrate their benefit. I'd also like to point out that regenerative medicine has been safely used around the world for decades. We look forward to helping you invest in your health and offer payment plans as we understand that these are out-of-pocket costs. Some previous medical options included medication, surgery, and cortisone injections. More and more, we're learning about the adverse effects on steroids into the joint and within the body. These injections, while helpful in the short term, are more detrimental in the long term. As more patients are treated, there's more data available. In this slide, we see that Asia is really paving the way in research of stem cell therapy. This is followed by the US and the United States. Much of these therapies have been available outside the US for an extensive period of time. However, in the US, there's more red tape when it comes to changing the standard of care. The anecdotal results that are being published are very promising. This is the very first therapy that can potentially heal and restore damaged tissue as well as help cells duplicate to heal conditions where there was little hope before. But there's still a lot of work to do. We can really break down the treatment options into three subsets, which include stem cells. These we harvest from either your bone marrow or adipose tissue, which is otherwise known as fat tissue. PRP, which is platelet-rich plasma. We use the patient's blood and a centrifuge to separate the platelets from other parts of the blood. A2M is found in the byproduct of PRP. When concentrated, it can be used in combination with PRP to help with symptomatic osteoarthritis. And allograft stem cells and amniotic tissues. These are donated tissues that contain stem cells derived from healthy live births. This is a good option for more elderly patients as we produce less stem cells as we age. I just also want to point out that these treatments are all available today, are ethical and without controversy. Platelet-rich plasma. Now I'd like to focus more specifically on PRP. So what exactly is PRP? PRP is short for platelet-rich plasma. Platelets are found in the blood and when centrifuged can be separated. These platelets contain special growth factors when concentrated that can aid in healing and restoration of tissues. PRP is typically injected into a joint space or tendon using fluoroscopic or ultrasound guidance. One of the great things about PRP is that it's an office procedure with a little downtime. Our office utilizes a system called pure PRP, which means we can separate the PRP even further and reduce the amount of red blood cells. This in turn usually minimizes the inflammatory response after an injection. We find that our patients get the benefits of PRP without the typical pain that's used to be expected from traditional PRP kits. Growth factors and cytokines. So PRP, in addition to containing a lot of growth factors, also has this special compound called a cytokine. A cytokine is able to signal important cellular functions. They work in conjunction with growth factors to signal cells to divide and multiply, thereby promoting tissue growth. Listed below are some of the typical growth factors that are found within platelet-rich plasma. Here we see the role in each of these specific growth factors. IGF works to stimulate bone growth. VEGF helps to get more blood flow to the area, which is vital for growth and healing. And EGF helps to stimulate more cell division and growth. Again, we see how different growth factors play different roles in the healing process of PRP. PRP therapy. While PRP has multiple uses, here at SCORE we're using it predominantly to help with pain relief. Traditionally, PRP has been used to stimulate healing of tendon, ligament, bursa, and joint injuries. And listed below are some of the areas that we're treating here at SCORE. The shoulder, elbow, wrist, hip, knees, the feet, the neck, and back. It is a really effective tool for osteoarthritis. The procedure. Prior to the procedure, we go over the preoperative and postoperative care instructions with the patient. This is to ensure that we give the PRP the best environment to work in. Typically, the most important step prior to the procedure is that we ask our patients to withhold from using any non-steroidal anti-inflammatories, which can include Advil, Aleve, Motrin, Mobic, or ibuprofen. The procedure is usually performed in the office, but depending on the body part, at times the procedure can be performed in a surgical center. So the first step is to obtain your blood. And don't worry, we've had a lot of practice, so this part is easy. Next, we take your blood and put it in a centrifuge, where some of the blood products are separated. We repeat this process a second time to ensure we obtain the purest PRP and minimize the red blood cells it contains, as I mentioned before. Once the PRP has been isolated, it is then injected into the area that's affected. After the procedure is completed, we typically want the area to be immobilized to ensure the medication stays where we want it to. For example, if a patient is getting their shoulder injected, I might have the patient bring in a sling and use that for a day or two following the procedure to minimize activity in that arm. So not all PRP is the same. Our system minimizes red blood cells and reduces the post-inflammatory response, as well as to concentrate the platelets up to 16 times that of baseline. This increases your chance of a better outcome. So I typically have my patients on relative rest for 48 hours and avoid high-impact activities for the first 2 weeks after the injection. Patients are expected to follow up 2 weeks after the procedure, and depending on the patient, they may be started in physical therapy or a dedicated exercise program. Just a reminder, PRP is a slow process, and we generally don't expect to see results for 6 to 8 weeks. So that means we have to be patient. Any questions? Don't wait. Call us today at 201-503-1900 to see if PRP is right for you.